Sir, why do you give tuberculinum in children, and especially in summer?
It has been told by Dr. J.T. Kent in his lesser writing that this tendency to catch cold, tendency towards the respiratory affection, tendency towards the recurrent cough, tendency or allergic conditions of respiratory tract, they are generally a manifestation of tubercular miasm. So, during summer, if you give tuberculinum, which is not an aggravation period of tuberculinum generally gets aggravated in winter season or rainy season. In summer, if you give these doses to those children who suffers off and on with these respiratory allergies or respiratory tendencies, that prevents, that removes the block, tubercular miasmatic block. And if you give tuberculinum in 1 m in February, then tuberculinum 10 m after 1 month in March, then in the month of April 50 m, and in the month of May cm, 1 dose every month, the energy gets boosted up in children. The susceptibility to miasm decreases, and as susceptibility comes normal, the further recurrence of the disorder becomes settled. So this is too important to give this tuberculinum, and I have used it practically since last 30 years. Generally, I used to choose tuberculinum if I found it out that patient is having, along with the respiratory allergies, he is having the skin manifestation in the form of ringworm also. Then I used to think of bacillinum instead of tuberculinum, because bacillinum has little bit ringworm tendency. Bacillinum has more skin manifestations along with the respiratory tendency. Both remedies having the similar miasm, but little bit changes are there, and that's why I used to consider bacillinum instead of tuberculinum when skin symptoms are associated with respiratory affection. And summer is, specific summer is only for that purpose, that it never shows any type of aggravations in the children. And if you treat the children, then their whole life, for their whole life, the respiratory tendencies can be prevented, respiratory affections can be prevented. And I have observed that those children I have treated in childhood, they become absolutely normal, they maintain their health in future. For that purpose, it is good to give a tuberculinum in the month of summer in certain doses. So generally my practical approach is always February, March, April, May. I used to tell my patients that in summer you have to take certain doses. Do come for taking the doses, so that it remains in their mind and they take it, and after their recurrence gets stopped. Okay? Thank you.